Picture this. It's 3 o'clock in the afternoon. You sit down, look at your feet, and they look like two small balloons. Your ankles have disappeared. Your socks have left a ring around your leg like a rubber band. And when you press your thumb into the top of your foot, it leaves a little dent that stays for a few seconds before slowly filling back in. Sound familiar? If you're over 60 and this happens to you regularly, I need you to watch this entire video. Because what most people don't realize is that swollen feet are never just part of getting older. Swelling is your body sending you a signal, and depending on what's causing it, that signal could mean something simple and easily fixed, or something that needs your doctor's attention today. Please keep in mind that this video is for educational purposes only and is not medical advice. The information shared is based on clinical research and established medical guidelines. Always consult a qualified healthcare provider before making any changes to your treatment plan. Before we dive in, I want you to know you are not imagining this, and you are not alone. Peripheral edema, that's the medical term for swelling in the feet, ankles, and lower legs, is one of the most common complaints among adults over 60. Studies suggest anywhere from 30 to 50% of older adults experience it to some degree. Some people notice it only at the end of a long day. Others wake up with it. Some people deal with it every single day. The problem is, most people either ignore it, assume it's just aging, or Google swollen feet, and get overwhelmed by a list of 100 different things and have no idea what applies to them. So let's clear that up right now. To understand why your feet swell, you need to understand a little bit about what your body is doing, or struggling to do, as you get older. Think about your veins like a set of pipes running through your legs. Every time your heart pumps, blood goes out through the arteries, delivers oxygen to your tissues, and then has to come back up through the veins, against gravity, all the way back to your heart. That's a tough job, and the veins have a clever system to make it work. Tiny one-way valves inside them that snap shut after blood passes through, preventing it from sliding back down. They also rely on the squeezing action of your calf muscles. Every step you take actually helps push blood upward. That's why walking is so good for circulation. Now, here's what happens as you age. The walls of your veins gradually become stiffer and less elastic. Research published in the journal Cardiovascular Research has confirmed this is a natural part of vascular aging. Those little valves inside the veins can also begin to weaken. When they don't close properly, blood starts pooling, sitting there in your lower leg, creating pressure that pushes fluid out into the surrounding tissue. That fluid becomes the swelling you see. At the same time, your lymphatic system, a separate drainage network that acts like a cleanup crew for excess fluid, also slows down with age. Less efficient drainage means fluid that leaks from capillaries into tissue doesn't get removed as quickly. And here's something most people have never heard. A protein in your blood called albumin is responsible for keeping fluid inside your blood vessels, like a sponge that holds things in place. As we get older, albumin levels can drop, especially if nutrition isn't optimal or if chronic illness is present. Lower albumin means fluid escapes into tissue more easily. Add declining kidney function. By age 70, the average person has lost 25 to 30% of their peak kidney filtration capacity, according to data from the National Institute on Aging. And you have a body that's just less equipped to manage fluid balance. Not broken, not diseased, just working with less reserve than it used to. That's why swelling that might not have bothered you at 45 starts showing up more consistently in your 60s and beyond. But, and this is important, these age-related changes are the backdrop. They're not the full story, because in most cases, there's a specific reason the swelling is happening, and identifying that reason is everything. Let's go through the main causes. I want you to listen carefully, because some of these require you to act quickly. Cause number 1, chronic venous insufficiency. This is the most common cause of lower leg and ankle swelling in people over 60, responsible for roughly 70% of cases according to data from Better Health. While aging and clinical vascular medicine literature, chronic venous insufficiency, or CVI, happens when those valve systems inside the leg veins fail to work properly. Blood pools, pressure builds, fluid leaks into the tissue around the ankles and lower legs. The classic sign of CVI, The swelling is worse at the end of the day and better in the morning after you've been lying down with your legs flat. You might also notice aching or heaviness in your legs, and over time, a brownish discoloration around the ankles. That's from red blood cells leaking out of the vessels and leaving an iron pigment called hemosiderin behind. CVI is not immediately dangerous, but if left untreated over years, it can lead to skin ulcers that are very difficult to heal. Don't wait on this one. Cause number 2, heart failure. I need to say this plainly. If your swelling is new, came on relatively quickly, affects both legs equally, and you've also noticed shortness of breath, especially when you lie flat, difficulty breathing at night, or rapid unexplained weight gain of more than 2 to 3 pounds in a single day, you need to call your doctor today, not tomorrow, today. Heart failure doesn't mean your heart has stopped. It means your heart is not pumping blood as effectively as it should. When the right side of the heart weakens, blood backs up into the body's veins, and fluid leaks into the surrounding tissues, including the feet and ankles. The American Heart Association reports that heart failure affects over 6 million Americans, with dramatically higher rates in adults over 65. It is one of the leading causes of hospitalization in older adults. I'm not telling you this to scare you. I'm telling you because many people with early heart failure don't know they have it, and swelling in the feet is often one of the first visible signs. Treated early, heart failure can be managed very effectively. Ignored, it progresses. Cause number 3, kidney disease. Your kidneys regulate how much fluid and sodium stay in your body. When kidney function declines, which can happen silently over many years, often driven by high blood pressure or diabetes, the body holds on to excess fluid, and that shows up as swelling. There's a specific kidney condition called nephrotic syndrome, where the kidneys start leaking protein into the urine. That lost protein drops the albumin level in the blood, and as I mentioned earlier, low albumin means fluid pours out into tissue. Kidney-related swelling often appears in the face, particularly puffiness around the eyes in the morning, as well as in the abdomen and lower legs. A simple urine test and basic blood work can screen for this, which is one of the many reasons a proper medical evaluation matters so much. Cause number 4, liver disease. The liver makes albumin. It also processes waste products and regulates dozens of functions that affect fluid balance throughout the body. When the liver is damaged, from cirrhosis, fatty liver disease, alcohol, or other causes, albumin production drops, and the body's fluid regulation system begins to break down. Advanced liver disease can also cause pressure to build up in the blood vessels that supply the liver, a condition called portal hypertension, which pushes fluid into the abdominal cavity and into the legs. Swelling from liver disease is often accompanied by abdominal bloating, a yellowish tint to the skin or whites of the eyes, easy bruising, and fatigue that feels out of proportion to activity. Cause number 5, deep vein thrombosis. This is a medical emergency. Deep vein thrombosis, or DVT, is a blood clot that forms inside one of the deep veins of the leg, and this one is genuinely dangerous. Here's how you tell DVT apart from other types of swelling. It usually affects only one leg. One leg swells more than the other. That leg may feel warm to the touch. There may be pain, sometimes described as a cramping or aching, in the calf or thigh. The skin may appear red. The reason DVT is an emergency is that the clot can break free and travel through the bloodstream to the lungs, causing a pulmonary embolism, which is life-threatening. The CDC estimates approximately 900,000 Americans are affected by DVT or pulmonary embolism each year, and the risk increases significantly with age, prolonged immobility, recent surgery, and certain medical conditions. If your swelling is one-sided, sudden, warm, and painful, do not drive yourself to the doctor. Call emergency services or have someone take you to an emergency room now. Cause number 6, lymphedema. Lymphedema occurs when the lymphatic drainage system is damaged or blocked. In older adults, this most commonly occurs after cancer treatment, particularly if lymph nodes were surgically removed or treated with radiation. It can also develop as a downstream consequence of severe chronic venous insufficiency. Unlike most other types of swelling, lymphedema doesn't fully resolve with rest or overnight elevation. In the earlier stages, the tissue may pit when you press it, meaning it leaves a dent, but over time, it can become hardened and fibrous. If you've had any cancer treatment involving lymph nodes and you're now noticing progressive swelling in one or both legs, discuss lymphedema with your doctor and ask for a referral to a certified lymphedema therapist. Cause number 7. Your medications. This is the one I promised to come back to, and it surprises almost everyone. A wide range of very commonly prescribed medications list peripheral edema as a known, documented side effect. This is not rare. It is actually very common and very frequently missed because the swelling develops gradually and people don't connect it to a medication they may have been taking for months. Here are the main culprits, all confirmed in peer-reviewed clinical literature. Calcium channel blockers. Drugs like amlodipine and nifedipine, commonly prescribed for high blood pressure and certain heart conditions, are among the most frequently identified medication-related causes of ankle and foot swelling. If you take amlodipine and your feet have been swelling, this connection is well established in medical literature. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, and naproxen, Aleve, cause the kidneys to retain sodium and water. Many older adults take these regularly for joint pain without realizing this effect. Corticosteroids like prednisone cause significant sodium and water retention with even short-term use. Thiazolidinediones, diabetes medications like pioglitazone, Actos, have fluid retention listed as one of their most common side effects. Gabapentin and pregabalin, widely prescribed for nerve pain, fibromyalgia, and as a sleep aid, both list edema as a frequent side effect. The prescribing information for gabapentin lists edema in up to 8% of users. Hormonal therapies, including certain estrogen-based preparations. Please hear me clearly. Do not stop any of your medications on your own based on this information. That can be genuinely dangerous. But do write down your medications and bring this question to your doctor. Could any of my medications be causing this swelling? That single conversation could solve the problem. Cause number 8, underactive thyroid, hypothyroidism. An underactive thyroid gland produces too little thyroid hormone, which slows the body's metabolism and causes a specific type of fluid retention. The swelling from hypothyroidism is different from most other types. It's often described as a doughy, non-pitting quality, meaning it doesn't leave a lasting dent when you press it. The American Thyroid Association notes that up to 15% of women over 60 have some degree of thyroid dysfunction, and many are undiagnosed because the symptoms, fatigue, weight gain, feeling cold, constipation, brain fog, dry skin, and swelling, are often attributed to just getting older. A simple blood test called a TSH level can diagnose hypothyroidism, and thyroid hormone replacement medication typically resolves the associated swelling. Cause number 9. Low blood protein, hypoalbuminemia. As briefly mentioned, albumin is the protein that keeps fluid from leaking out of your blood vessels into surrounding tissue. When albumin drops, due to poor nutrition, chronic illness, liver problems, kidney problems, or systemic inflammation, fluid escapes more easily throughout the body, including the legs and feet. Studies in the European Journal of Clinical Nutrition have found that a meaningful proportion of adults over 65 living independently have albumin levels below optimal ranges, often tied to inadequate protein intake. This is especially relevant for older adults who may have reduced appetite, difficulty preparing meals, or chronic illness affecting absorption. If you've had blood work done recently and your doctor mentioned your protein or albumin is on the low side, this may be directly contributing to your swelling. Cause number 10, simply not moving enough. This one is less dramatic, but it's extremely common and very real. When you sit or stand in one position for a prolonged period, the calf muscle pump that normally moves blood upward is inactive. Blood and fluid accumulate in the lower leg under gravity. This is why feet swell on long flights. It's why office workers get ankle swelling after sitting at a desk all day. And it's why older adults who are less mobile, whether from pain, fatigue, illness, or recovery from surgery, can experience persistent daily swelling. The good news? This type of swelling responds very well to the interventions we're about to discuss. Okay, now let's talk solutions. Number 1. Compression therapy. Compression stockings are the most extensively studied, most consistently recommended non-drug treatment for lower extremity edema, particularly for venous insufficiency, which, as we covered, is the #1 cause of swelling in older adults. Here's how they work. They apply graduated pressure, highest at the ankle, gradually decreasing as you move up the leg, which physically assists the movement of blood and lymph fluid upward, preventing it from pooling. A 2018 systematic review in the Cochrane Database of Systematic Reviews, the gold standard for medical evidence, confirmed that compression stockings effectively reduce edema and symptoms in patients with chronic venous insufficiency. This is not new news in medicine. Compression therapy has been a clinical standard for decades. But here's what matters for you: the level of compression. 15 to 20 millimeters of mercury is mild compression. You can buy these over the counter at a pharmacy. Good for mild, end-of-day swelling and prevention. 20 to 30 ml is moderate compression. This is where most people with diagnosed chronic venous insufficiency end up. You'll want your doctor's guidance on this level. 30 to 40 mmHg and above is for more serious conditions and is typically prescribed and fitted by a healthcare provider. 2 important cautions. If you have peripheral arterial disease, blockages in the arteries of your legs, or significant diabetic vascular disease, compression may not be appropriate until your arterial circulation has been assessed. Ask your doctor and put the stockings on first thing in the morning before you get up, while the swelling is at its lowest. Number 2. Proper leg elevation. This one sounds obvious, but the way most people do it doesn't actually work, and the difference matters. Simply kicking back in a recliner with your feet slightly raised is not the same as therapeutic leg elevation. For elevation to effectively reduce edema, the legs need to be raised above the level of the heart, roughly 12 inches or 30 centimeters higher. That means lying on your back and propping your legs up on pillows stacked high enough to genuinely exceed heart level. The recommended approach from clinical guidelines: elevate the legs this way for 30 minutes, 3 to 4 times per day. A study published in the journal Phlebology confirmed that proper leg elevation at heart level produces measurable reductions in lower limb volume in patients with chronic venous disease. It works when done correctly. One note for anyone with heart failure: aggressive leg elevation can shift a large volume of fluid back into the central circulation rapidly, which may stress an already compromised heart. If you have heart failure, talk to your cardiologist specifically about whether and how to use leg elevation in your case. Number 3. Activate your calf muscle pump. Your calf muscles are, quite literally, your body's built-in venous pump. Every contraction of the calf squeezes the deep veins of the leg and pushes blood upward. This is why walking is so powerfully good for circulation. It keeps that pump running continuously. A study in the journal International Angiology found that a supervised walking program significantly reduced lower limb edema in patients with chronic venous insufficiency. But even if walking is difficult for you, whether because of pain, balance concerns, or other mobility limitations, there are simple exercises you can do seated that activate the same pump mechanism. These have been validated in clinical research and are specifically recommended by the American Venous Forum. Ankle pumps. Flex your foot upward, pulling your toes toward your shin, then point it downward, back and forth, in a smooth pumping rhythm. Do 20 to 30 repetitions. You can do this right now in your chair. Ankle circles. Rotate your foot in a circle, 5 times clockwise, 5 times counterclockwise, on each foot. Heel raises. If you can stand safely with support, rise up onto your toes, then lower back down. 10 to 20 repetitions. These powerfully contract the calf. The key rule: avoid staying in any one position, sitting or standing, for longer than 30 to 45 minutes without doing a brief set of these exercises or taking a short walk. Number 4. Reduce dietary sodium. Sodium controls how much water your body retains. For every extra gram of sodium in your system, your body holds onto roughly 200 milliliters of water to maintain concentration balance. More sodium, more fluid, more swelling. Multiple randomized controlled trials and clinical guidelines from the American Heart Association, the American College of Cardiology, and nephrology societies all confirm that sodium reduction is a cornerstone intervention for managing edema, particularly in patients with heart failure, kidney disease, and liver disease. The general recommendation is no more than 2,300 milligrams of sodium per day. For people with heart failure, kidney disease, or high blood pressure, many guidelines recommend 1,500 milligrams or less. For context, 1 teaspoon of table salt contains about 2,300 milligrams, and most Americans consume well over 3,400 milligrams a day, almost all of it from processed and restaurant foods. A 2016 analysis in the New England Journal of Medicine confirmed that even modest reductions in dietary sodium produce measurable benefits across populations. In practical terms, this means reading labels. Canned soups, deli meats, packaged snacks, fast food, and restaurant meals are the primary sources. Cooking at home and using herbs, citrus, spices, and vinegar for flavor instead of salt is one of the most effective dietary changes you can make. One important clarification: sodium restriction doesn't mean elimination. Sodium is an essential electrolyte. The goal is reducing excess, not depleting it. Extremely low sodium intake can itself cause problems, especially in older adults. Work with your doctor or a registered dietitian to find the right target for your specific situation. Number 5. Find and treat the underlying cause. Everything else in this list is symptom management. This is the fix. Think of swelling like water pooling on the floor. You can keep mopping, compression stockings, elevation, exercise, and those things help. But if you don't find the leaking pipe, the water keeps coming. Treating the cause is finding the pipe. A proper medical evaluation for persistent edema in an older adult should include a thorough history and physical exam, a review of all medications, and blood work that at minimum covers kidney function, liver function, albumin level, thyroid function, TSH, and a urinalysis to check for protein spillage. Depending on findings, your doctor may also order an echocardiogram to assess heart function, a Doppler ultrasound of the leg veins to check for DVT or valve failure, or other testing. Once the cause is identified, treatment is far more effective than managing symptoms alone. Heart failure? Medications including diuretics like furosemide, ACE inhibitors, beta blockers, and other evidence-based therapies can dramatically reduce fluid retention and improve quality of life. Venous insufficiency? Beyond compression, options include endovenous laser ablation, radiofrequency ablation, and sclerotherapy, minimally invasive procedures that treat the failing vein directly with excellent clinical outcomes. Hypothyroidism? Thyroid hormone replacement resolves the associated swelling, often within weeks. Medication side effect? Your doctor may adjust the dose, switch to an alternative, or help you weigh the trade-offs. Lymphedema? The evidence-based gold standard is a program called Complete Decongestive Therapy, involving manual lymphatic drainage by a trained therapist, compression bandaging, specific exercises, and meticulous skincare. Diuretic medications, water pills, are often prescribed for edema. They can be effective, but they come with real risks. Dehydration, electrolyte imbalances including dangerously low potassium, and kidney stress. They should be used under medical guidance with appropriate monitoring, not self-prescribed or taken inconsistently. The bottom line, a diagnosis changes everything. Don't settle for, "This is just how things are." I told you at the beginning that we'd stick to what science actually supports. So let's be honest about a few things that get promoted frequently, but don't have the clinical backing to match the hype. Epsom salt foot soaks. Despite widespread promotion, there is no high-quality clinical evidence that soaking your feet in magnesium sulfate reduces systemic edema. It may feel soothing, it may relieve muscle tension, but it is not an evidence-based treatment for the underlying fluid accumulation. Herbal diuretics like dandelion and parsley, these lack sufficient clinical trial evidence to be recommended for edema management. Horse chestnut seed extract is a partial exception. A Cochrane review found limited evidence it may reduce symptoms of chronic venous insufficiency, but the evidence quality is low to moderate, and it is not a substitute for proper medical care. Drinking less water. Paradoxically, restricting water intake can sometimes worsen edema, When the body senses dehydration, it can trigger compensatory fluid retention mechanisms, unless your doctor has specifically told you to restrict fluid intake. As in certain cases of severe heart failure or a condition called hyponatremia, you should stay appropriately hydrated. Essential oils and topical creams. There is no clinical evidence supporting their use for systemic peripheral edema. I'm not saying these things are harmful. Some may be perfectly fine as comfort measures. But I want you to know what is proven so you can prioritize the things that will actually move the needle. I want to leave you with this. Swollen feet after 60 are not a life sentence. They are a symptom, and symptoms have causes. Causes have treatments. And you deserve a clear answer about what's actually happening in your body. You've taken the first step by watching this video. Now take the next one. And if this helped you, if it gave you clarity or peace of mind or something specific to act on, please share it with someone you know who might need to hear it. You may genuinely help them. Take care of yourself. You deserve to feel good.